Welcome back to the channel. It's Dr. Durst, and I have a special guest with me today, and we're going to deep dive into some trending and just aesthetic topics overall. And welcome, Raquel. And I am saying that right.
Yes.
Just correct me if ever. So Raquel Merlini. So I'm going to do a brief introduction. I'm going to let you go from there. So Raquel does own a business and a med spa in Michigan. And we have connected digitally because she has a very different approach and perspective on aesthetics. And I loved seeing that. And so we wanted to get into a conversation and bring that into the public because I think the direction of aesthetics is really kind of just moving and pivoting a little bit. And so welcome. So why don't you tell us a little bit about your practice and your experience?
Yeah, so my practice is located here in Michigan, and I first started my career as an esthetician. I gained my license in Charlotte, North Carolina. I'm originally from Michigan. We relocated in the crash of 2008, and I didn't have any friends or network. And it was just recommended, why don't you try aesthetic school? Because I'd always been in the beauty industry. So I gained that license, and then we relocated back to Michigan. And I knew I wanted to be in plastics. One of the great things about being in aesthetic school, we would go and visit med spas. And I knew I didn't want to be in a salon atmosphere. Not that there's anything wrong with that, but I just knew that I was more geared towards medical. I ended up having 3 opportunities, and I selected the one there. He was the chief of plastic surgery for a very prominent hospital located here in Troy, Michigan. And I ended up working for him for 13 years. He came to me probably after a year that I'd already been employed. I was just taking some rudimentary classes. And he said, what do you want to do with a degree if you gain one? And I said, I'm not really quite sure. I like psychology. And he said, if you became a nurse, I'd teach you everything I know. And then I ended up being trained in all disciplines of the practice, the med spa, our injectable center, our OR, where I would operate, be involved in the operation and procedures as well. So, and then now here I am 16 years later, and even more in love and passionate about the industry and where it's headed.
Yeah. And so back then, that was because, again, I used to sit, I didn't open the business when a friend of mine was opening one just because it wasn't the right time. But at that time, I was like, hey, there's going to be med spas on every corner in some future time. That's where this is headed. So you could see where it was, but you were, again, entering the industry then when it wasn't a thing.
Yeah, I didn't have the tools. It's always interesting. I've mentored all of my injectors. They've either started with me as assistants or medical, my MAs, my medical assistants, and then they wanted to go to nursing school themselves. So now, with videos and so much information that is available, I mean, I had to go get a hard copy book and hope that I could learn some anatomy through that, and then the products have changed. There weren't very many products. Even if you recollect, the only on label for Botox was the glabella at the time, and we were going off label back then. So the resources definitely have improved tremendously.
Yeah, and maybe even to an overwhelming degree for people entering into it, right? Because they need almost a good foundation strategy before you get off on, all the things now because there's a lot out there. But yeah, so that was a long time ago before it was even a thing. But I think that when you're talking about, so yours was really a medical also entry into it where I think that makes a big difference because I look at it differently as well. And maybe even me saying that you had a med spa in Michigan might not be the appropriate terminology as well. I don't know because again, I try to say that we're not. We do all of the med spa type stuff, but more regenerative aesthetics, overall. And you do a lot of lasers and some biostimulatory fillers because I looked at everything. And again, I think that us talking about that because that's more of the move now is that there's more of a regenerative component to what we're doing, which wasn't present over the last 10 years, really. Would you agree with that?
I do agree with that. I mean, My physician at the time was one of the few physicians who was working with Radius, your Kaha biostimulator, as well as he was one of the forefront physicians with Sculptra. So I've been working with Sculptra now for the last 13 years. And I know I'm a former competitive bodybuilder, so I'm also very informed with facial volume loss, facial wasting, that now being a woman these, a lot of patients are coming in with that volume loss, as well as coupling it with what we're seeing, the GLP-1s surge. So, biostimulation stimulation products definitely are leading the forefront where people hadn't heard of them before.
No, I agree. And so when you talk about like beyond beauty, because that's kind of what you're looking at it just not from an aesthetic standpoint, but from an overall standpoint. And again, we do a very comprehensive when it comes to wellness too. But the aesthetic piece of it, we have a lot of people that will enter through that thinking it's just kind of straight up aesthetics, but I believe that that's way bigger as well. Talk a little bit about what your perspective is when you say beyond beauty, like what your overall, what does that mean to you?
So, yeah, I mean, overall, I think that it's more, I think if you look good, you feel good. And if you feel good, you look even better, you radiate differently. So I think, we're busy moms, we're busy wives, mothers, sisters, children of adult aging parents where we're caretakers. And oftentimes we put ourselves last as opposed to the forefront. And I think that women are, they're wanting to feel a little bit better about themselves, which brings them to the aesthetics treatment room. I know also being a middle-aged woman that our hormones, which, I'm hoping you're going to touch on the wellness aspect, because I think that that's so important, as well as it's, your diet, your nutrition. What are you doing to recharge yourself, your mental health as well as physical health. So I think it's just all encompassing, and that's what my belief is. Every patient that walks in, it's not just a transactional experience. I want to know what's going on behind the scenes. you know why are you looking tired? Why are you not feeling as optimal as you can? And if I don't have the tools or the resources, I have a tremendous network that I'm able to refer my patients out to, so that they can build upon that all over, hormones, right? Wellness, longevity, I think is a little bit more where the industry is heading.
And I think that with your background of like fitness and that health focus, that, again, you can't help but look at it differently because that's part of it. And I think we'll talk to this. One of my big mindset, like my perspective changes over the last year. And I think I kind of just woke up with this suddenly. I'm like, there is no one and done. Like, so I have a lot of people like, do I need to do this? Do I need to repeat it? And I'm like, we do our hair every month. We do our nails every month. We're not fit if we go to the gym one time. We're not healthy if we eat one healthy meal. That, yeah, this is a commitment over time. Our skin is exposed to everything. It turns over just like our hair and nails. So a commitment over time to anything that kind of empowers them to have healthier skin overall. And we'll talk about lasers because collagen is a huge part of that, right? Not just, Botox and filler, that you almost can't help but look at it from more a comprehensive when you have that fitness and health background. I think that almost makes you want to empower women. They're coming to us to look better, but it's what I'm hearing from you is that it's really kind of empowering them overall from a holistic standpoint. I don't really like the term holistic, but I mean it from the whole person, the whole woman. And we do a lot of men too, and even from the whole aspect. But that's kind of what I'm hearing you say is like you're looking at them from overall.
Yes, very much. I mean, for me, when creating, so we've been in our space now 2.5 years. And what I really wanted to create here at Our Skin was I wanted to build a safe haven where every patient is seen, heard. Oftentimes our partner doesn't always see us or hear us. Our children are busy with whether they're in the thick of things with their school or they're now adult children and they're raising their families, right? So, we wanted them to be at ease from the moment that they walked in, free of judgment. I didn't want my patients to feel pressure or that it was a one size fit all approach. Or more, like you mentioned, looking at it as a marathon, not a sprint. You're going to It's not a one and done. I want to empower them so that they can embrace their own natural beauty and give them the confidence so that, they can leave and just feel a little bit better. And if it's not always even physically, that they feel better, I want them to know that, their time here was well spent as well.
You wanted to create a special place for them to come. And I think that's awesome because I do think that people get lost in all the different options. There's actually like the med spa nation now, like where there's more med spas than McDonald's. Like that's kind of sad. Um,
So
and it is really sad. But I feel bad for them because they actually get confused by all the information. And we want to take that out of it and be that source so that they don't have to go down the rabbit hole. But I think that starts with the relationship you form from the first phone call or the first, entry into the door, really. And it sounds like that's what you guys have done is kind of create a special place for women to go. Do you do a lot of women? Do you see a lot of men entering into the aesthetic? Like from just a straight up aesthetic standpoint, what percentage would you say of men are coming in the door?
So I'd say we're still predominantly female based. However, I feel that since COVID, when people were working from home and seeing their face on camera, maybe doing Zoom or, something similar to what we're doing right now, working in that remote office, and men were starting to view themselves on camera, right? I mean, as women, I just think we're always a little bit more hyper aware of our looks and comparing ourselves to someone else. But all of a sudden, men were realizing, and I don't want to say that we are an ageist society. However, when if you've lost a job or companies were restructuring and now you've got to go into a marketplace after 20 years and maybe you have a little less hair, or all of a sudden you're realizing that this line is making you angry, and you're not angry, but it can be off-putting to a customer if you're in sales. So I do feel like we have seen an increase with male patients, maybe a 5 to 7% increase for
Yeah.
sure.
Okay. Yeah. Yeah. I think they need to beautify too. At some point, we'll talk about it. Maybe we do another one at some point and we talk, but I think that like men need to beautify. And we have a lot of men that watch our YouTube channel and sometimes they're not so concerned or interested in the aesthetics. At least that's what I think, but I don't know until we actually do some that actually talk about it and see how the response is. And then it sounds like with all the like video stuff that you're talking about, and we're doing it more, we were looking at it ourselves. And I think that again, getting on and doing videos. Women are the hardest on themselves. So I have this conversation. I had it with like 3 of my patients that I saw yesterday. I just want to know what they would like to see improved because they're the hardest. Like we're the hardest on ourselves. They don't need anyone else to tell them anything, right? And frequently, we're not even really seeing, necessarily what they're seeing. But you would agree, right, that women we've been like that. It's innate, I think.
I love that point because, like you just mentioned, they're coming in. I try not to prejudice myself against what it is that may be bothering them because I can look at something and see like a clear indentation in the center where it's the first thing I want to go to and fix. But they may have something that's like a brown spot on their face, and that's more, bothersome to them than what I'm seeing. So, again, sitting down and listening and hearing what the patient um, bringing themselves into the treatment room for, and making sure that I address their need, not just what I want to do or what I see.
Yeah, because sometimes I mistakenly way back had probably brought something up that wasn't bothering them. And again, as we already see, we start to do something, and I think that then they see something else from that. So that's improved, and then now all of a sudden they're seeing, and that's where I think women just are hardest on themselves. And so it sounds like you get to know your women well over time, like your patients well over time, because it's that relationship building that you're doing from the start. Right, and then that can talk a little bit about how, like, a person with all the stuff out there in the med spa nation and all the social media and the overwhelm, how would somebody be able to spot an office that would be high quality? Because there's lots of them out there. What are some things that you would tell our listeners to look for from the aesthetic standpoint, especially with, your massive amount of experience. You've seen a lot of things over the years, and you've probably corrected a lot of things over the years too. So what would you suggest to them to look for, either whether it's on social media, on a website, experience that would help guide them to something high quality, a office high quality?
Yeah, well, definitely some red flags. Always I would read reviews. Not always put stock in the reviews, but see if the reviews at least are consistent. So I think that's a number one important. I think unfortunately in a social media driven world, somebody can put out some amazing content with before and afters, but that doesn't mean that they're knowledgeable or that they're going to hand pick, they're going to cherry pick, right, and only put their good before and afters. So education, I think, is really important. One of the things in medicine, we're taught to educate the patient, to make them aware of why we are making our decisions and what is the best interest for that patient. So I think that that's really important. Also, what are their credentials? I can't believe the amount, our area, we do have a med spa on every single corner. I mean, in my building, there's three in my building alone. So, you want to make sure that you look at what their qualifications are. Are they doing continuous education? Are they searching out and being educated and trained? Is that important? How long have they been at their facility? It's like anything else. If I see that they have hopped to three different med spas to be an injector there, why is that? Because, one, I understand, but if they've been at three locations in a year, it looks like they possibly might be the problem, right? So you want to look where all have they worked. You can always check, make sure that they're licensed. I imagine I have patients that come through that are like, I didn't know I went with the Groupon. I went with the best deal. And I'm like, that person's not even licensed. This is medicine. Botox, Dysport, they are medications that you have to have a medical director. No, those laws are in different states because every state, it is the wild, wild west, right?
It is. It's different every state.
Right. So, there's a lot of red flags. And then also when you go into the office, are they a hard sell? Are they pushing you to make decisions? I think that that's a red flag. I tell my patients, you can have a free consult. You don't have to have treatment today if you're brand new to me. Most of my patients have been with me for 10 to 13 years. But if I do get a new patient, I'm like, come on in, let's have a discussion. We'll put together a treatment plan. We leave room if they want treatment in there. But look at the staff. Ask the staff, are they warm? Are they friendly? Is the place clean? You know, we keep our OSHA, we're HIPAA compliant. We make sure that I've got an AED here. I have Narcan. I have, if we've got a vascular occlusion, we know, my staff knows what to do. So, you just want to make sure that they are credentialed. And then finally, because I know I'm rambling, but
Oh, no, that's okay. Yeah. It's all good information.
looks frightening, that's their ideal of beauty. And some people like that overdone look, but if you walk in, I've got all different age groups here and they look frightening. I would run because that's their ideal of beauty. So, I think aesthetics, the industry has gone so sideways. I think the pendulum now is swinging back, but it was originally just so that you looked enhanced. You were supposed to look refreshed. You want to be got a new hair, a hairdo. But I'm hoping that the overdone big everything is on its way out. So look at their ideal of beauty.
Everything in the US becomes supersized at some point. So, like, the because even when I, like, trained on threads, smooth threads and twist threads are more popular internationally, and everything was a lift here. It's like a supersize. We go right to the big guns, and so I think that you're right. I think that is actually there is a move against that now. And I do know for us, because we have a lot of wellness patients that are entering our aesthetic, services, that's probably the number one thing that they say is one of the reasons why they're comfortable like switching over to that aesthetics is because no one at our office looks like that. And again, that is just explain that we're going for the natural look, but also that that's more of a provider and patient mismatch, right? It really has to be a provider willing to overdo and a patient wanting it, because I also say like one syringe or a treatment of your cheek or lips is not going to do that. Because you've heard it too. I know that somebody doesn't want their lips done because they don't want to look like this. I'm like, no syringe, one syringe in your lip is going to blow you up like that ever. You're just restoring volume that we're losing each year. So, no, that's probably the number one thing. And do you think that there's a way that they could see who like is directing the care there, like you directing all the care? Is there a pretty good way for them from a website to kind of see who that oversight person is? Because I think the fact that you're kind of like training everyone and have all that experience, I think that's a great probably first point when they get onto the website, that they're kind of looking for who's like, always showing up, like who's overseeing everything. That's probably a pretty important thing too. Like maybe easy because sometimes that credential and, experience and it's hard to tell without maybe kind of seeing that at least you can trust the source person, which would be you.
Right, right. And I have a phenomenal medical director. We actually worked together at the previous location. She was a injector, a doctor who was injecting as well. And, she is very knowledgeable and, available to us at all times. So, and she's on our website and all of her information is there as well. So I think that's important, too. Again, going through and making sure that you can identify the injectors and the personnel. I mean, I even list my medical assistants because they were medical assistants at our previous location for our physician. So they were trained. I was a medical assistant before I became an injector as well. So, we're pretty multifaceted here, but I definitely think, again, going and interviewing, that's the beauty of having the internet and everything at your fingertips, is you can sit and interview that medical practice and who's there to make sure that that's even going to be a good fit for you.
It's interesting. It get complex because I know that there's even one here. I potentially think locally that there's a lot of back, alley talk you hear, but I don't see that present when you look at that, particular business online. So sometimes it can get complex. But so we were talking about aesthetic injectables so far for the most part, but kind of going over to the lasers because you do a lot of lasers. And the aesthetic injectables is where kind of the aesthetic industry started almost, it seems like that filler, Botox, and that's grown over time with all the options and, in different ways to do that. But lasers has been like kind of a hidden science and secret, in my opinion. What's your take on lasers and how important do you think that is to aesthetics now?
I love them. I think it's pivotal because I've seen even after somebody gets a facelift, they would come to me post-op and say, I had a facelift. why does my skin still look like this? Well, if you have those iridids and that crepey skin with those, crisscross hatch lines from years of, using baby oil and betadine, not protecting
Yeah.
your sun,
Yeah.
and wanting to get on those beaches, then of course your skin quality and texture and tone is not going to be optimal. So yes, you may have had some lift, but you know having that laser is a priority, as well as your medical grade skincare. So I love a CO2 laser. I don't think that there's much that can compare to that. Um, Microneedling, I think, is amazing. I like traditional microneedling, doing a combination therapy. And then we've got like other lasers that are going to heat up the skin, help with stimulating collagen, help to smooth those lines. So I think that lasers are often overlooked. However, also a very you want to tread cautiously because you've got to worry about those Fitzpatricks. And if anybody listening and the Fitzpatrick, it is your heritage, the color of your skin. And, I've got a large Middle Eastern population here where they can be fair, even blue eyes and lighter hair, but their skin, the minute that they get in the sun, they're going to bronze up like a little golden baby. So, got to make sure that you do your homework again when it comes to getting those laser treatments. But I've had 5 CO2 lasers in the last 10 years, and it's always my first if I can afford the downtime too. And then I like the maintenance with doing the other lasers in between.
Yeah, no, I love that. We have like 16 different devices too, so lasers is a huge part. I love the laser science, kind of geeked out on it, and so I know all of our lasers really well, and I have a very experienced laser esthetician that I've known for 15 years, and she has a very dark skin population too, like she does, a very like the most like, I guess her patient population is probably the darkest skin types that I've seen, that somebody is comfortably treating with any kind of laser. She's awesome with it. But we have, just to put it out there, because it's not a well-known thing, we don't have CO2 in ours, but we have a fractional ablative, but it's a photona laser, so it's kind of different. That photona can do like a 4D, which is a non-surgical facelift. It's not a usual laser, but my point is like that fractional one can get as deep as a CO2 just for the if you wanted to, but a lot of our patients don't want the downtime. So that allows us to kind of do instead of like a full stop, CO2, that we can actually do, lesser speeds of that. And it's just more treatments over time, which our patients tend to do well with. And we could give them a lot of downtime if we wanted to, but it was an option that I didn't know. And our frequently patients will call asking about CO2 in the office. So we've done a previous podcast with the laser physician expert that taught us this laser. And we were talking about that exact thing. It just is an alternative that a lot of people don't know about because there isn't a really good one laser that does that fractional ablative that could go as deep. But this one, you can really alter what you're doing. But I agree with you. Like CO2 is awesome. It's just that our patients, we kind of have to push for them to get like a 2 or 3 days of downtime. And so a lot of them don't want that. But again, combining even your CO2 or your other lasers with that regenerative injectable is, just completely enhancing for the ultimate outcome and results. At least that's what we've seen. So I think trends, and I think that we can probably get into a separate, like video talking about just trends in 2026, because just opening up what you see has changed over 2025 and then me too might be super helpful for people listening. But some of the trends, what do you think, like the top 3 things that you see kind of popping out has increased over 2025? What would you say?
Definitely facial balancing. I have patients come in quite frequently are asking, okay, what is this facial balancing? So understanding that a little bit more as opposed to just targeting a cheek or a lip. Again, I think with the GLP-1s, not slowing down at all. That revolumizing the face is important. So I think that's a definite trend. I do think that people are wanting to go a little bit more bare faced. So they are starting to think of skincare first, both at home, as well as in the treatment room, asking those questions. The great thing is our patients, it can be a pro and a con, right? So I think that they are more educated and knowledgeable, being able to have resources at their fingertips. But then I also think that there's a lot of misinformation out there too. But so those would be my two. My third one, um, I don't think it's necessarily, I think it's a consistent trend is just maybe that baby Botox, having some movement, but um, not being as frozen. So, the word baby Botox, not everybody understands that always,
Mhm.
but they want to be able to have some movement so that they're able to animate and engage, but not looking frozen. So I think that that would kind of be my top three.
Okay, that's good. The and baby Botox, I will say that my younger staff have brought that up. So I think that's probably a social media trend too. And I keep saying, well, they can learn about it and bring it to me because otherwise I'm kind of, again, I will ask people always. I'm like, and when I train our staff, which I train all of our staff, it's do you want to be frozen? And if they look at me like I have two heads, then I know they don't know what that means. And so they're not treat it that way. And so,
Right.
and that's kind of, and otherwise people are usually coming in saying it, right? I want to be frozen. And then if they don't, I just say, do you want to be frozen or you, and when they don't know what that means, then I know they don't want to be frozen. And so otherwise I don't really know what the baby Botox is because I would just be treating them to the non-frozen level. Is that where they're actually putting just really like, is it under the eye, along the jaw? I've heard a lot of different
Mhm.
um, aspects of that. Where is that done?
Well,
Educate me. I don't even know. And
I'm not really sure on the concept either. I mean,
okay, good. Yeah.
I'm seeing a micro droplet, but I think that that's treating more skin texture, um,
Okay.
as opposed to, I just think it's a coined phrase that people are thinking of. I mean, you still
Okay. Yeah.
proper dosing to get the longevity of those 3 to 4 months. So when I hear the word baby Botox, what I'm thinking more of is they just don't want to be frozen.
So I think it's a trend. Then I probably would safely say after you and I not knowing, and we both have a lot of experience with aesthetics, that it's probably a trend more than anything, because it's just a younger person that probably doesn't want as much at first. But the younger person never gets as much because they're new to it. Their movement isn't as strong, and I will say that with men, and we probably do about 30% overall, probably even higher than that now, overall to the practice, not just aesthetics, but to the practice, because we do a lot of wellness and hormones and that and sexual wellness that they need double. Like a man needs double, like hands down. And my staff, when I would train them, look at me like they're so nervous to do the man for the first time. When I'm like, no, you need to put double because they have such strong muscles. And every time it's pretty much true that it's about double what they need from a Botox standpoint, just so we know. But when it comes to hormones, just because we talked a little bit about that for you, do you have any questions when it relates to? Because we do a lot of um, hormones in women, but I think what you addressed really much in the front end of this is that you said when people feel better, they want to look better, and I think that that's what we find is that somebody comes in and they come in for hormones, they're overall just not feeling like themselves. That's the bottom line. There's multiple different reasons why they're not feeling like themselves, but they're not. And they haven't been given answers or solutions. And so that's when we're looking at a hormonal, you know, we're looking at it from a hormonal perspective and panel and optimizing them. And a lot of times there's some sexual complaints that go along with that as women get older and men too. And then, yes, they feel better and then they want to look better, and, again, that's part of it. We actually do kind of we do a complementary laser treatment. We have the Lutronic LaserMD, which is one of the ones we use a lot of, and we do that as a complimentary with a consult, just because it's an awesome, just kind of overall entry level, but it gets them glowing, and then and it just kind of again, it's something that's needed when they haven't felt well for a while. Just empowering them to feel good again.
Yeah, I like that idea. That's great. I mean, I think with the chronic stress levels, cortisol, it will increase your oil production. You've got inflammation, breakouts. That collagen is definitely broken down, accelerated much more quickly. So, and then the hormonal imbalances with the dryness and the crepiness, which then that laser is going to hydrate and make your skin glow. I mean, I think that that's brilliant. It's optimizing that internal health, because if you're taking care of yourself intrinsically, then of course it's going to reflect extrinsically, right? So that's a really good, I like that idea.
Yeah, we do that with all of them. It was kind of almost a thank you for trusting us on your hormone journey. And so when we actually see them, because we'll see them for what what their goal is and how they're feeling, and then we'll see them and go over labs and, make a treatment plan for hormones. And then at that point, we put them on for a complementary. It is actually a great idea for whoever you're partnering with up there that's doing hormones, that patient could potentially, you guys could work together too, just to get them into, and some of them are afraid of lasers, but because I feel so strongly about it, and that LaserMD with the fractional non-ablative, we can do just an ultra glow, very mild, and it's fine lines, wrinkles, pigment, pore size, and gosh, if they added like a Botox onto that, in 3 to 5 days, it's transformative, right? And then they really feel good, and it's 100% satisfaction because it's not a scary laser. But what do you think that from a laser standpoint, what is your, like, most common kind of maintenance, or pre-rejuvenation laser, technique? Because I always say there is very limited technologies, but there's unlimited brand names, so it can get overwhelming when we bring new staff on because people will call with a certain technology. We may not have it. Well, we really have it, but it's not that name. But what kind of, like, technology, if it wasn't a brand name, what do you think is the most common, like, just on a regular basis that your patients are doing for collagen stimulation?
So R2 for the collagen stimulation would be microneedling and laser genesis. So again, I think that people get caught up, they're very familiar with Halo and, doing a Moxie, a BBL, and a Halo treatment. Well, that's just a brand name. And, I have my patients not get hung up, because I think the technology can be great. However, it's also who's administering that technology, right? Understand the skin? Do they understand the parameters and the limitations, as well as how far they can push that laser to get the best result? So, again, I think that's where we fall back to education, is that the provider needs to be very educated, and then the provider needs patient on why we're doing that certain technique. So our laser genesis it's very relaxing. It heats the skin up so that you're going to get that collagen remodeling, as well as texture. And again, it's a nice relaxing treatment, non-ablative, that patients love. And I like to stack it with a dermaplane, so that you're removing that extra barrier of dead dry skin cells, as well as that vellus hair. And then, hydrating the skin after. And like you mentioned, patients 2 to 3 days later, they're getting stopped because, people are asking them, like, what did you do? Especially here, I'm getting blasted with dull, dry, air. The humidity is terrible. I've got a humidifier next to my desk. It's very cold here in Michigan. So, I think that the treatment that is going to hydrate the skin. And then I always love something that's going to deal with pigmentation. So, those brown spots, age spots, those little telangiectasias, which are the broken capillaries that over the breakdown of collagen. Those will pop up on the skin or after childbirth or anything else strenuous in life. I love something of an IPL or a BBL. And that's where, again, don't get hung up on the names. Intense pulse light and broadband, they achieve the same thing. It's just one better at marketing. So that would helps with the pigmentation.
Yeah, that's what I always try and tell new staff to like dummy it down because we do so many different things. I'm like, so if you don't understand, there's very limited technologies, unlimited brand names. It may be confusing. They say laser genesis. We don't have that. You can say, what are you looking to improve? And oh, okay, yes. Well, we'll get you. We have, because we're pretty certain we have a technology that's going to do it. But let's get you into the provider and she can decide which one, is best. And so, because I do think it gets overwhelming for patients, but it also gets overwhelming for staff. So if somebody calls and we don't have a CO2, they're like, no, we don't have it. And if they just let them off the phone, they wouldn't know that we have something that I think is more appropriate for our patients, just because our patients don't want the downtime. That's all. And so if we can do it a little slower with more treatments, that's kind of what they've liked. And so, but it's interesting because it could be overwhelming for sure. So what I would like to kind of, even if we maybe kind of schedule another one, I'd love to get into kind of the consult, like kind of how you approach like a new patient and then a consult into the office. And just because we've been working to standardize, we do so many things that I don't think it's just confusing for patients on the internet or confusing for patients that see our website, but it's also confusing for our staff sometimes. So we've been trying to kind of standardize that. And maybe us talking about like what a patient should expect when they come in for a consult with an office would be super helpful. Um, can you think of anything else before we finished this one at all? Because I think we should continue conversations because I think we can deep dive into just biostimulatory fillers and what that does. And we actually do a lot more radius. We don't do sculpture, we do radius, but I think it's good to have people, and I know you're familiar with both, but I think it's good because it's a frequent question for just people to know, about both of them and why sometimes people prefer one versus the other, because both of them are going to biostimulate and form collagen. And I think that alone is a topic in and of itself. But I think it's great. You have a great practice up there. It sounds like you're really empowering women overall to feel better and about, the aesthetics and that a natural slow. I just think it's a commitment over time. When I say there's no one and done, I'm always saying there's no one and done because somebody will come in for a thread treatment or they'll come in for, it could be even a pigment treatment, and if it's corrective, clearly they need a series of something. But even if it's a series of something, it's like, well, do I need to repeat it? And it's like, again, there is no one and done. Like it is a constant commitment of something. So sitting back down with them, kind of assessing where they are and what results they want still. But it's just like hair, nails, fitness, and nutritional eating. It's like a slow commitment over time gets them an amazing transformation over a year. And that treatment plan for each we can talk about, but I think that it's going to be different for each of them. But still, in that year, we would have had aging skin. And instead, when we show them a year transformation in their before and afters, it's amazing. And you sit down and you show them that, and it's still natural, it's not surgical. But I think you can only get natural results if you're kind of committing to something slow over time and it's a journey and you're looking for a long game transformation. I think that overnight, no pain, no downtime overnight. If it's too magical before and afters on the website and they say that's one treatment and that's going to do that. If it looks too good to be true, then it is. There is no magical overnight, no pain, no downtime, and the technology is never going to get us that.
Right.
without a knife, right? And most of our patients aren't really looking for that. That's why they end up in front of us, right? But
Definitely words of wisdom for sure.
yeah, it's amazing to me though what I think it for me it was a mindset change because I no longer kind of almost have to defend why you might need to repeat something. Instead, it's almost an expectation, like it's a commitment over time. We're going to get to know each other well. It's not like you're going to have to be here every 2 weeks and it's an overwhelm. But like this is kind of what somebody might do in a year. And if there's a correction, it'll be a series. But yeah, there's maintenance but I think that skincare is just one part of that framework in addition to the other. But I think if a consult, if we got back on and talked about that, we can almost kind of talk about what that framework to, you know, um, good natural results looks like.
Well, and I think you're absolutely right. And that's why, going back to sitting down, having the consultation process with the patient, putting together, assessing, and putting together a plan. I mean, that's, I think, when you're going to receive your best optimal result, right? It's
Yeah.
about the relationship. You said it perfectly.
When we do a lot of, again, we'll do a lot of videos and marketing. I love the marketing aspect. So I'm a little geeky and we'll read about it. And I have obviously Haley and a whole team that is helping. It's a team for sure that it takes. But I say that like even if we're doing videos and educational material, that once they get into the office, that the staff is now the expert that has to educate them along the journey to results because they might end up in front of us because they want a treatment. They're scrolling on social media, they see something, they go to Google and see who does it, right? And then they end up in front of us, but it's the treatment that lands them in front of us, but it's the relationship with that provider that really is why they stay. They're buying results and they're staying because of a trust relationship that they have with you, with your staff, with my staff. It's not like from the video or social media alone. They're only staying if they actually can form that relationship with their provider. And I'm sure that from a business standpoint, and for as long as you've been doing it, you probably, if you had anything else, like kind of to add to, like any providers, any, wisdom tips, anything else that you would say along that line that like really helps them form that relationship?
Be honest. If I don't have the answer, I will seek out the answer for them. So if I don't know something, I like to lead with honesty and integrity. And then at the end of the day, also just being authentic, being yourself, not trying to be something that you see on Instagram or this worldly provider. I mean, we're all, in this industry. Some have more knowledge than others, but I think that you need to be honest and forthright and authentic with your patient in order to build any relationship.
And down to earth. You are very like that authentic, but really down to, because again, you do see that on social media. You hit it. Like you see it and it's like the Miami, like flashy stuff. And I'm like, that's great, but that really is not, that's not our patient. Like it's not our ideal client, our ideal patient. That's not who is coming to us, the ones that are going to love that necessarily. But I agree. I think, and then recently I had done a wellness, and sometimes I like to share it, like, especially if it like hit when he was talking about, he was great. It was a wellness, longevity, service that we're going to provide in the future. And what he said, I love, is just, again, what you said, and he took it a little further, is that, our job is to be honest and to state like the facts. And if that, as long as that's what we're doing and we're not giving them an answer based on what we think they want to hear or what we think they can actually afford, it's really, we're giving them the honest facts. We're just speaking the truth about what it would take to get results. And it may not be a fit or or the time for the patient, but we can do next steps. But I still think it's about being honest that, Yes, it's going to take a series. Yes, it's going to take a commitment if you want to keep your skin young and healthy. And that's a transformation over time. It doesn't mean you have to do everything that everyone else is doing. And it may be that you're just doing this next. But I think still the long game is that our skin ages all the time and we need a commitment over time. And that is dependent on what the patient needs and wants and can do. But I still think trying to candy coat it as if we can get them something, after a couple treatments and guarantee their pigment's going to be lifted is just being dishonest, right? And it's us saying what we think they want to hear.
I think there's a lot of charlatans in the industry who are trying to sell snake oil. So back to your not one and done, and if I even think that you're a candidate and you're willing for surgery, let's get your skin conditioned so that you again will get that goal, get that result. And I'll refer to a plastic surgeon. I mean, again, my toolbox, is not unlimited. And if they're willing to be open to the surgical route, then again, I will refer out because they're still going to have to come back and have their muscle relaxed, have those neurotoxins. And unless they get fat grafting, they're still going to need little tiny ritids and lines, corrected. So, leading with honesty, I just think it is the best practice.
And I do think that more surgeons are now doing lasers, probably related around the surgical time, but I don't think that was happening for a while. And so I kept saying the same thing, like we can lift and tighten, but unless if we're actually making that skin thickness healthier, you're still going to need the lasers at the end of it all, just to keep the skin healthy. But I think that is changing a little bit. That perspective might be changing some. At least that's what I'm sensing on social media. But anyhow, I think it was great to have this conversation. I would love to talk about the consult at some time where we just kind of sit down and say what a patient should expect kind of when they come into an office. And it's good to even have my staff hear a different approach because I kind of have a general concept, we do it only one way, right? So I would love to hear with all of your experience, you're going to do some parts of it the same and probably some parts of it different. And I would love to hear more about that so that we can enhance our patient experience for sure. So, well, awesome. Well, it was so nice to have you on. I love it. And thank you, Raquel, for again, being on, sharing your experience. I think we should do this again because I think the aesthetic thing for me is something I've been working on because it's one part of our business, but it can be time consuming sometimes for me with the other aspects, and the sexual wellness is really my passion. But because we do such a good job from a regenerative standpoint and a natural, and it's just kind of the science and what I like about that, it really does apply to it, that I'm never willing to give it up. But I think that we're just focused on how we can make that better in 2026. And so I would love to have another conversation about that so that patients would know what to expect with a consult, and also our staff might be able to learn a lot from that to improve their consult. So that would be awesome.
Yeah, I would look forward to that. I mean, you're so knowledgeable and I follow you. And I think with the longevity and regenerative, that is definitely where the industry's headed. So I look forward to following your journey and learning, walking away a little better for the experience myself.
I would at some point, we'll get into this behind the scenes because I won't put these up, but there is like something aesthetic we do like from the sexual wellness standpoint too, which is really transformative. It's just, again, that it's the best before and afters we have, I will say, because it's easy to get. It's the vagina, and there's like really one image. You don't have to turn it 5 different ways to see the results. So the before and afters are pretty standard because, as you know, before and afters are hard to get sometimes, the lighting, the angles. But these are good. And just so you know, we do a lot of remote wellness patients. We get a ton of peptides and hormones. And so we do a lot of that almost in every state because sometimes it's hard for them to find that
Mhm.
locally, and they know and they see us on YouTube and they reach out. But there is a aesthetic procedure I'll show you after we get off. And then we could always, yeah, that's another one that I think women, at least knowing it can happen, and it's called the 4V. We do have some on the website, but it's like videos we've done before just talking about it, where it's a facelift for the vagina done by that same laser, that Photona
Wow.
laser. And basically, when we did the 4D on the face and it was non-surgical facelift, that same laser expert physician was like, you can do this on the vagina too. And so we came back and started doing it because we're a sexual wellness. But a
Yeah.
lot of places that have that laser don't do like down there is what, because they're doing aesthetics. And
Right.
then a lot of aesthetic offices aren't going to do that. And gynecologists kind of aren't on board for doing things that are kind of outside of the box.
Mhm.
And so right now, we're pretty much the only ones doing it, but it is a pretty amazing. I'll show you after.
Yeah, that's exciting.
But yeah. All right. Well, perfect. Well, and again, our skin aesthetics in Birmingham, right? Michigan, cold up there, but and a great practice up there with just tons of experience. And so Raquel, I really want to thank you for being on and sharing all your vast amount of knowledge and experience with us. So thank you. And again, let us know what you think. If there's any questions, because we can always also get back on and discuss some questions. So let's start a conversation in the comments and let us know, because we're willing to deep dive into anything aesthetics, wellness, or sexual wellness. Thank you.